Right, let me ask you something. When was the last time Labour actually delivered on a promise without it spectacularly backfiring within 12 months? If you're still thinking, don't worry, I'll wait. Actually, scratch that, we haven't got all day because there's a fresh wave of NHS strikes brewing, and apparently Wes Streeting's masterclass in industrial relations is about as effective as a chocolate teapot in a heat wave. Welcome back to UK Daily Coffee, where we serve up British politics with extra shots of reality and a generous helping of I told you so. I'm your host, and today we're diving into Labour's latest triumph, promising to end NHS strikes only to watch them multiply faster than Tory leadership contests in 2022. So here's the thing about political promises, they're a bit like gym memberships. Everyone makes them with the best intentions, pays upfront, and then pretends they never happened when reality kicks in. Labour waltzed into power last year with all the swagger of someone who'd just figured out the secret to world peace, announcing they'd put an end to NHS strikes forever. Spoiler alert, forever lasted about as long as a Liz Truss premiership. The backstory here is absolutely delicious in its irony. Labour's brilliant strategy was essentially throwing money at the problem like a drunk person at a casino. Doctors got 6% pay rises, senior NHS managers pocketed 5%, and resident doctors hit the jackpot with 22% over 2 years. That's more generous than your nan at Christmas, and about as sustainable as running a marathon in stilettos. Wes Streeting, our beloved health secretary who clearly missed the memo about under-promising and over-delivering, stood up in September and declared victory over strikes. He boasted about ending the catastrophic impact of industrial action that had cost taxpayers £1.7 billion. That's billion with a B, by the way, which is roughly the same amount the government spends on consultants to tell them things any 5-year-old could work out. But here's where it gets properly spicy. Remember when your parents told you that rewarding bad behaviour only encourages more bad behaviour? Well, apparently nobody mentioned this to the Labour front bench. Stuart Andrew, the shadow health secretary who's having the time of his life watching this unfold, put it perfectly. The message from Wes Streeting was clear: militant behaviour is rewarded. It's like giving your teenager a Ferrari after they crashed the family car and then acting shocked when they wrap the Ferrari around a lamp post. Who could have possibly seen this coming, apart from literally everyone with functioning brain cells? Now the Royal College of Nursing is threatening to ballot members for industrial action because they've rejected a 3.6% pay increase. 3.6%. That's barely enough to cover the rising cost of decent coffee, let alone the sort of inflation that's been munching through everyone's wages like a hungry hippo through watermelons. But wait, there's more. The resident doctors, clearly feeling left out of the party, are threatening more walkouts after their 5-day strikefest last month. 5 days! That's longer than most people spend thinking about their life choices, and probably about as effective. Meanwhile, family GPS are getting twitchy about their role in these shiny new neighbourhood health hubs that the government is rolling out as part of their 10-year NHS plan. 10 years! That's optimistic considering most government IT projects can't survive 10 minutes without catching fire. The British Medical Association is making ominous noises about future disputes unless GPS get reassurances about pay and working conditions. It's like watching a very polite version of a gangster movie where instead of cement shoes, they threaten you with strongly worded letters and ballot papers. And just to really put the cherry on this chaos Sunday, Unite Union conducted a ballot that found 89% of NHS members rejected the pay offer, with 95% willing to take industrial action. 95%! That's a higher approval rating than any politician has seen since Churchill was fighting actual Nazis. The union is talking about strikes affecting ambulance trusts and national organisations including NHS England and NHS Blood and Transplant. Because nothing says we've fixed the NHS like having the blood supply potentially disrupted by industrial action. Here's what really gets me about this whole situation. Labour spent years in opposition pointing fingers at the Conservatives, saying they couldn't manage industrial relations if their lives depended on it. Fair enough, they had a point. But then they get into power and their grand strategy is essentially paying protection money to every union in sight and hoping for the best. It's like watching someone criticize a chef for burning dinner, then taking over the kitchen only to set the entire restaurant on fire. At least the Tories were consistently incompetent. Labour promised competence and delivered chaos with a side order of how did we not see this coming. The government's response to all this criticism has been, and I'm paraphrasing here, look, we're really trying, okay. The Department of Health spokesperson wheeled out the usual statistics about waiting lists being the lowest in 2 years and satisfaction with GPS being on the up. That's like saying your house fire is under control because you've managed to save the garden shed. They're also claiming they've delivered 4.6 million appointments in their first year, which sounds impressive until you realize that's roughly the same number of appointments that get cancelled every time there's a strike. It's like boasting about filling a bathtub while someone else is pulling out the plug. The really delicious part of all this is how Labour painted themselves into this corner. They made such a big deal about being the party that could work with unions, unlike those nasty Conservatives who apparently treated workers like something they'd scrape off their shoes. But it turns out that being too cozy with unions is a bit like being too friendly with your neighbour's cat. Before you know it, they're living in your house and demanding premium food. Stuart Andrew has been having an absolute field day with this, pointing out that Labour's new employment rights laws are going to make strikes even more likely. They're removing the rule that 50% of eligible union members must participate in strike ballots for them to be valid. Because obviously what this situation needed was making it easier to organise strikes, not harder. It's like removing speed limits because you think people will drive more carefully. The logic is so backwards it could get a job as a government advisor. The fundamental problem here is that Labour confused symptom with cause. NHS strikes weren't happening because workers were inherently militant or because they enjoyed standing around in the cold with placards. They were happening because the system was fundamentally broken, staff were overworked and underpaid, and nobody in government seemed to have a clue how to fix it. So Labour's solution was to throw money at the immediate problem without addressing any of the underlying issues. It's like putting a plaster on a severed artery. It might stop the bleeding for 5 minutes, but you're still going to need surgery. The 22% pay rise for resident doctors was particularly mental. Not because they don't deserve decent pay, they absolutely do, but because it sent a clear message to every other group of workers in the NHS, if you want a proper pay rise, you'd better get yourself a picket line. And now here we are, with nurses rejecting 3.6% rises and threatening ballots, doctors planning more walkouts, and GPS getting nervous about their future role in the system. It's like watching dominoes fall, if dominoes cost billions of pounds and potentially put people's lives at risk. The irony is that Labour probably could have avoided most of this mess with a bit of forward thinking. Instead of massive one-off pay rises that looked generous but created unrealistic expectations, they could have implemented sustainable long-term reforms that addressed career progression, working conditions, and the structural problems that make NHS jobs so challenging. But that would have required actual leadership rather than just writing bigger checks. And let's be honest, genuine healthcare reform is about as popular with politicians as root canal surgery without anaesthetic. What makes this even more frustrating is that the NHS genuinely needs fixing. Waiting lists are still ridiculous, staff morale is in the gutter, and the whole system is creaking like a Victorian floorboard. But instead of focusing on these real problems, we're back to playing industrial relations whack-a-mole. The government keeps talking about their 10-year health plan like it's some sort of magic bullet. 10 years! By the time this plan is implemented, we'll probably have robot doctors and teleportation technology. Meanwhile, people are still waiting months for basic appointments and the staff are threatening to go on strike again. And let's not forget the elephant in the room here, Brexit. Remember how leaving the EU was supposed to give us an extra £350 million a week for the NHS? That worked out about as well as everything else about Brexit, which is to say not at all. But at least it gave us some entertaining bus slogans. The really maddening thing about all this is that everyone saw it coming except apparently the people making the decisions. It's not rocket science. If you reward strike action with massive pay rises without securing any reforms in return, you're going to get more strike action. It's basic human psychology, the sort of thing they teach in management courses that politicians apparently skip. So here we are, with Wes Streeting looking about as comfortable as a vegetarian at a barbecue, trying to explain how his master plan to end strikes has somehow resulted in more strikes. It's like watching someone try to put out a fire with petrol and then acting surprised when everything explodes. The sad truth is that patients are going to suffer through all this political theatre. While politicians play games and unions flex their muscles, people are still waiting for treatment, operations get postponed, and the whole system limps along like a three-legged horse trying to win the Grand National. What we really need is someone with the courage to admit that quick fixes don't work, that sustainable solutions take time and effort, and that sometimes doing the right thing isn't the same as doing the popular thing. But apparently, that sort of leadership is rarer than hen's teeth in modern politics. Instead, we get Wes Streeting promising the moon and delivering a handful of space dust, while opposition politicians practice their "I told you so" faces in the mirror. Meanwhile, the NHS continues to stumble along, held together by the dedication of its staff and the patience of its patients, both of which are wearing dangerously thin. The bottom line is this: Labour promised to fix NHS strikes and instead created a system where striking is actively rewarded. They've turned industrial relations into a game show where the biggest tantrum wins the biggest prize. And now they're surprised that everyone wants to play. It's like complaining about getting wet after jumping in a swimming pool. The consequences were entirely predictable, completely avoidable, and absolutely inevitable given the decisions they made. So that's where we are with the NHS strikes saga, a perfect storm of political incompetence, union opportunism, and systemic dysfunction that would be hilarious if it wasn't so serious. Wes Streeting might have thought he was being clever by throwing money at the problem, but he's basically created a monster that's now eating everything in sight. And the best part? We're not even a year into this government yet. At this rate, by the time they're finished, we'll be nostalgic for the days when the biggest healthcare crisis was PPE shortages and test and trace apps that didn't work. Right, that's your daily dose of political reality served up with extra frustration and a generous helping of British sarcasm. If you enjoyed watching me dissect this latest government shambles, smash that like button like your Wes Streeting's approval ratings. Subscribe for more daily doses of political chaos, because let's face it, there's always something new to complain about in British politics. And don't forget to hit that notification bell, because you won't want to miss the next inevitable government U-turn or ministerial resignation. Until tomorrow's coffee break, this has been UK Daily Coffee, keeping you caffeinated and thoroughly disillusioned with the state of British politics.